want to talk about health as opposed to talk about healthcare. So what I want to do is serve as the opening act for Dr. Short, who's going to talk about choosing wisely. But I entitled the presentation, Choosing Wisely Macro, because Choosing Wisely Canada talks about the micro level, but we have to make some choices at a much higher level. And this is the same presentation I gave, well, a little modified for the inaugural address at the Canadian Medical Association. It's the same presentation I've given in Bridgewater, Nova Scotia. I just gave it in Dublin. I just gave it in Vancouver, Saskatoon. And the pulse out there is that these are the things we need to talk about. These are the things that will allow us to build on the micro level that we're going to drill into in a few minutes. So I really want to talk about health because I think the only way we're going to really improve healthcare in this country is if we get rid of the patient. Now, I get in trouble at the CMA when I say that, but I'll try and explain to you what I mean by getting rid of the patient. And I don't mean physician-assisted suicide or euthanasia. What I'm talking about is keeping people from coming into the system in the first place. So for you that are physicians in the audience, this is the one thing that I'm going to keep repeating over and over again. Never has there been a greater opportunity for our profession to shine than right now. And we need to seize that opportunity because the public is not quite happy with what we're doing as a profession. Now, I would encourage you to give me a little bit of laughter or fight so that I know I'm making some progress in my mission. Because you know the universal law that Gandhi said was, if you want to achieve things that are really, really spectacular, all you have to do is watch what people do. First, they'll ignore you. Then they'll laugh at you, then they'll fight you, and then you'll win. And I'm at the stage where people are sort of still ignoring, starting to laugh. So if you could laugh at the end of the presentation, then I know that I'd be making a little bit of progress as we move on this journey together. Now, this is a complicated roadmap, but I'm going to simplify it for you very quickly. We're actually going to get through this in about 15 minutes because I know you're very intelligent and you can listen very quickly. And these slides are available to anybody that wants them. They're on the back computer. If you want to use them, take them and move ahead with them. But there's three themes that I want to talk about. Healthcare transformation, health equity, and the last one is advocacy. Now, the healthcare transformation basically is choosing wisely at a micro level. There's other things. The only thing I'm concerned about with choosing wisely, and I'll be very honest with you, I was in this room when people were totally excited about patient safety and health quality, and that was what was going to change the whole system. Well, that fad has come and gone, and now we're into a different fad, and I don't know what's going to come after this one. So I'm always cautious when people are proposing simple solutions to very complex problems. So be very careful if you think that this by itself is going to solve the problem. Health equity talks about how to get rid of the patient in the first place in more detail. And the last one is advocacy, how we can advocate. Now, the Canadian Medical Association is the oldest medical organization in the country. It's as old as the country. It's reflected in our address, 1867 Alta Vista. We're as old as the country. And so I think it's only appropriate that the Canadian Medical Association take a leadership role in this area. So if we're going to transform healthcare, we have to know what we as physicians do. And we have to understand what unique value proposition we bring to the table. The next two slides are very brutal in your face. Close your eyes if you're not used to this stuff. But when a patient like this comes into a healthcare system, we know for a fact that there's only one healthcare provider that assumes full responsibility for that patient. It's not a nurse practitioner, it's not a pharmacist, it's not a minister of health, it's not an administrator, it's a physician or a team of physicians that assume responsibility for this patient. We know that. And that's the unique role that we play as physicians, is we're not afraid to assume responsibility. Now the question is, how far does that responsibility extend out? And that's what we have to identify as a profession. What do we do that's so unique that only we should be doing it, as opposed to other healthcare providers? And until we can answer that question, the profession is going to be nibbled at by nurse practitioners, physician assistants, nutritionists, naturopaths. Everybody on earth thinks they can do what a physician can do. And physicians are sort of standing there not really identifying what's so unique about their training. So as a profession, we have to really identify what is so unique about our training and what we do. Because if we don't do it, the profession will be redefined by others. Now, this is the one that people really think I've lost my marbles when I talk about. But I really do not think there is enough love in our systems. All I keep hearing on an almost daily basis is physicians complaining about this, complaining about that, complaining about everything. Now, we don't teach our trainees, we don't teach our medical students and our residents to love these complicated systems, but we have to stop the bitching. And when I said this in Ireland a couple of weeks ago, I thought they were going to ask me to leave the country, but they actually started applauding. So I think physicians across the world understand that the times of complaining are over. We have to stand up and learn to become followers. We have more than enough physician leaders, but we don't have enough physician followers out there. So I think that if you want to really find out how a healthcare system's performing, just ask a whole bunch of physicians if they love the system they work in. Not whether they love medicine. Most of them still love medicine. But if you ask physicians if they love the systems they work in, very few hands go up. And so we have to challenge the profession to teach our learners and trainees to love these complicated systems. It's not good enough to know how to do medicine. You have to know how to take care of these systems that we work in. Now, here's the difficult thing to understand. 5% of patients consume about 60% of resources. These are figures from Saskatchewan, and I believe they're figures. If you've got Alberta figures, give me them. That's them. Okay. But that's the whole point. 5% of patients consume 60% of healthcare costs. Now, we're talking $2.8 trillion a year are spent in North America on healthcare. This is combined U.S. and Canadian healthcare numbers. I get critiqued for mentioning the Institute of Medicine study of sort of inefficiency in the U.S. system, and they say, well, why don't you use Canadian numbers? Well, you give me the Canadian numbers and I'll start using them. But these are numbers that I trust. And take a look at what's going on with unnecessary services, inefficient delivery of care, excessive administrative costs, inflated prices, prevention failures, fraud. It's about 35% of that total, which is $750 billion, which is almost 4 times the Canadian healthcare expenditures on a yearly basis. These are enormous amounts of dollars that are totally being wasted. What do we need? We need better governance. All right? We need far better governance, not only at our provincial level, and we spoke about this morning, but we need to drill it down into the department level as well. We need greater accountability. Physicians have really pretty well gotten away with whatever they want over the years, and there hasn't been that much accountability unless you really screw up, and then you end up in front of the college. But otherwise, as an emergency physician, I rarely get feedback on how I'm performing, good or bad. And the last one is, we have to train the 100,000 people that work within Alberta Health Services how to have crucial conversations. We are terrible at having crucial conversations. Our reaction when someone wants to bring up an issue is we either fight back immediately, run away, or freeze and try and disappear into the background. We have to train individuals to have these crucial conversations. Sam's going to come up in a second and start talking about choosing wisely as to how we can actually start doing something about it. Now I want to talk to you about, if you really want to make people healthy, don't focus on the healthcare system. You want to make people healthy, read this book. This should be mandatory reading for anybody that's got anything to do with setting policy. You want to improve health? Well, understand the notion that reducing the income from the richest to the poorest within a society will improve people's health. We're very fortunate that the mayor in this town has said that poverty is going to be a priority for him. So how many of you have called the mayor and said, I'd like to work with you on this issue? And if you haven't, you should. Because if he's successful in what he's doing in reducing poverty, he'll probably have far more impact than what we can have as a profession. And I'm not saying that to belittle the profession. All I know is poverty is a disease. And the sooner you get rid of that disease known as poverty, your health will improve almost immediately. So assuming you're born with a full complement of genes and you follow what the Norleen Foundation in Calgary has been trying to tell us for years, and what I think last year's IAG forum focused on, early childhood development, these are the things that make you healthy down the road. And you're going to spend the money sooner or later. You can either spend it early on in a child's life, or you'll spend it later on in health, education, welfare, as we're doing right now. So for those of you that really still think healthcare is what makes people healthy, the healthcare system may contribute 25% of an individual's health. The rest of it comes from things way outside the healthcare system. And if the minister's telling us that we're not going to have money to invest in the things that really make us healthy, then we're in a catch-22 situation here. For hundreds of millions of years, you know, these guys did not have to go to a gym, you know, at the end of the day to look buff. You know, we come from a nation, we come from a heritage of hunter-gatherers. And hunter-gatherers, by and large, were very healthy. Yet within the last 27 years, we've gone from hunter-gatherers to not so healthy anymore, right? You've heard of Generation X? Well, I'm going to steal a line from Gary Marr. We've got Generation XXL coming down the pipeline. And that generation is going to cost us an enormous amount of money. And that's why I think every kid should be bused to school and drop 5 kilometers from the school, and they can walk the last 5 kilometers. Because we've got a real problem with our young kids that are growing up right now, in case you haven't noticed. This is all you should be eating. What are we doing at Alberta Health Services to promote this? Last time I checked, I still don't understand why we have Tim Hortons and White Spots and all sorts of junk food distributors right within our healthcare institutions. I mean, it's embarrassing. It just sets, I think it sets the absolute wrong message to the public. So I'm going to simplify illness for you. You can read this book by David Agus, who talks about how we really could reach the end of illness, or you can remember 3 numbers, 3, 4, 50. 3 risk factors: smoking, inactivity, and poor nutrition. And I'd like to acknowledge the passage of one of the toughest tobacco bills in the country that passed, I think, last night within the province. Alberta is a true leader in this area. But smoking, inactivity, and poor nutrition contribute to 4 major diseases: certain cancers, diabetes, chronic respiratory and cardiovascular illness, and that accounts for 50% of the disease burden out there. Yet does every physician and healthcare provider talk to each and every patient about smoking, inactivity, and poor nutrition? We should. With NetCare, we should be able to develop a plan for each and every patient, and every time we interact with them, we move them along that journey. Think about that potential. My favorite topic is, this is how many Canadians die every year as a result of injuries. It's a fully loaded 737 crashing every 4 days. And yet we sit back and accept that. And Alberta, as you know, has one of the worst injury records in the world, in industrialized nations. This is the low-hanging fruit that we should be going after right away. We have to have people that are really, really well-trained in how to interact and understand why people like these things. And these things are the very reasons why we have a healthcare system. Each of those things that gives you immediate satisfaction also is a disease on its own. And that's why 50% of our disease burden comes from things that are pretty well predictable and preventable. Fatigue we never talk about, yet fatigue is a major problem. And I'm appalled at the level of substance abuse and its impact on our health system today and the little attention that it actually gets. And as was mentioned, we're fortunate to have moved to develop a focus around mental illness, or as some of my colleagues tell me, rather call it brain health issues. But mental illness, fatigue, and substance abuse are major problems within our society. So this is wrapping up. We used to love this slide because we could say that the feds were totally disengaged, but with our new Minister of Health, the feds have re-engaged in the healthcare portfolio, and we're excited to work with them. But this is what I want to end with. When you have the Governor General of Canada issue such a blunt warning at the convocation of the Royal College, I think that the profession really better wake up. I'm not going to go through and read it, but it basically says that we have a contract with society. And that contract gives us a monopoly over knowledge and practice in a very specific discipline. And if we as healthcare professionals are not serving the best interests of the public, then what the public will do is rewrite that contract with us as a profession. And so when healthcare poll after healthcare poll shows that the impression of physicians in the eyes of the public is dropping, and it's dropping quite rapidly, then I think that we better heed the warning of the Governor General and understand that we really need to refocus on what's in the best interest of society. And that's why the Canadian Medical Association is actively involved in healthcare transformation, trying to push the social determinants of health, the impact of poverty as a disease, and being strong advocates for change. And the last thing I want to remind you is what I started with, that there's really never been a greater opportunity for us to shine as a profession. And don't for a minute underestimate the honor and prestige that's bestowed on us by the public to be physicians. So Sam's going to now take us into drilling down as to what we can actually do. But, I always have a good laugh when I read Choosing Wisely, because it reminds me, what have we been doing up to now if we have to create a slogan called Choosing Wisely? I guess we've been choosing unwisely, maybe we've been training unwisely, and maybe we've been allowing unwise practice to occur right under our noses. So choosing wisely scares me, because it makes me beg the question, what the hell have we been doing up to now? So thank you very much.